Welcome back. In a 2022 report, Colorado ranked worst in the entire nation when it comes to mental health in adults, according to Mental Health America.
One bill is working to allow for people dealing with mental health problems to get help faster by letting psychologists prescribe medication. This is an idea that's been popping up more and more nationwide, so let's give you some perspective.
According to the American Psychological Association, the idea of giving psychologists the ability to prescribe medication started 3 decades ago. The Department of Defense conducted a 6-year trial to allow psychologists to prescribe medication in military bases. The program was successful, so the idea spread.
In 2002, New Mexico became the first state to pass a law allowing these medical professionals to prescribe medication. Now, 4 other states followed suit. Denver 7's Brandon Richard talked with one lawmaker who wants to add Colorado to that list.
Colorado faces a mental health crisis. 2.8 million Coloradans live in areas without enough psychiatrists. And the shortage is severe when it comes to psychiatrists who treat children. Just 16 per 100,000 residents. Many counties have none.
It takes you months, for some people, months and months to get in to see a psychiatrist.
State Representative Judy Amable says she understands what that wait is like.
My own family has really struggled with this. I have a son who has significant and persistent mental illness.
Amable has introduced a bill to allow psychologists to prescribe mental health medication to their patients. Right now, if a psychologist believes their patient would benefit from medication, they must refer them to a psychiatrist for evaluation. Amable says her proposal will cut down on the wait time.
It will ensure that more people get access to care in a way that they can afford it and in a way that is effective for them.
Some doctors and medical groups support Amabele's bill, saying it addresses a huge problem here in Colorado, but many others are fiercely opposed to it. Adam Burstein, a Denver psychiatrist, wrote a letter to lawmakers outlining why he thinks the bill is bad.
I have a personal frustration, if you will, when politicians make changes to medical policy.
Burstein says even though it would require psychologists to undergo additional training and education, he says they still won't have the in-depth knowledge needed to prescribe medicine.
You could learn psychiatry meds, but that doesn't help you actually be a competent prescriber.
He also worries the bill will lead to an over-prescribing of medication.
The more I do my job, I do not think that medication is the answer. Putting more and more kids and adults on medication is not the answer.
Amable says other states that allow psychologists to prescribe medication haven't seen such problems. The bill passed the House with an overwhelming vote and will now be considered by the Senate. In Denver, Brandon Richard, Denver 7.